Today we're going to be demonstrating how to make what we call a reverse sugar tong splint. This is our preferred sort of splinting for distal radiuses in an acute setting to allow for post-trauma swelling, and then eventually we will convert them to a cast. Or sometimes I also use this immediately post-op in the operating room after a distal radius or IF, and I like to put them in this type of splint to provide a nice stability and cushion to allow for soft tissue rest, and then later we convert them to a formal thermoplast or a resting wrist brace. So what you will need is some cotton web roll, some plaster, and usually 1 or 2 ace bandages. You'll open up the fingers. Okay, most important is around the thumb, which is the toughest part. So usually I just create this little space, and then you want to make sure that you stop right before the MP joint so that you allow the fingers to flex. Some web rolls aren't very flexible, so you have to sort of rip it. Far ends and the distal ends. Then I make sure they can bend their fingers. What I like to do is I measure the volar sort of component, and that's the size, and then roughly about the same for the dorsal. So that's about the size that you want. Usually, I just cut a slit until there's a little bit left. You can also angle it if you want to kind of match the orientation of the palm, the fingers. Then I like to bring this over and sort of make sure everything is well and cohesive. And then place that over like this, and like this, like that. And that's how it goes. And then you take one more sort of roll, if you have it, and sort of kind of a little bit more tightly collapsing it together. I'm going to take the piece and always cut a little thumb hole. So I like to sort of tuck it to make it nice and neat. So usually I go above first once like that, then I go below right next to the thumb, and then relax your arm, and then go all the way down. And actually, maybe we can just use 1 ace for you. Usually I use at least 2. And then a little pressure, and you just mold it, trying to avoid the tips of your fingers and pads, just using the larger surfaces. And this will heat up and warm up as it sort of hardens. And then what I like to do, sort of tuck this in. Make sure they can make a full fist because we want the fingers moving, but the wrists immobilized. Then we tuck this part in as well. Make it look nice and neat, at least for the time being. And so that would be a typical sort of reverse sugar tong splint that we may put you in an acute setting of a distal radius fracture, or immediately post-operatively in the operating room after a surgery to protect our repair. Plaster is nice. It's sort of a little bit old school, but you're able to really mold it the way you want it to, and you have more sort of ability to work with it.